Many food industries use trans fatty acids in making some foodstuffs because they are relatively cheap. But this comes at a cost for consumers in long term, especially for the majority of vulnerable persons who cannot afford the alternatives for a healthy living. Trans fatty acids are manufactured fats created during a process called hydrogenation, which is aimed at stabilizing polyunsaturated oils to prevent them from becoming acids and to keep them solid at room temperature. They may be particularly dangerous for heart health and may pose a risk for certain cancers. According to experts, the elimination of trans fatty acids could save 17.5 million lives over the next 25 years and reduce the cost of healthcare. But what do people need to know about trans fatty acids?
Trans fatty acids are a type of dietary fat, so something you find in our diets, and they are the unhealthy fats, if you may say, and we get them in processed foods, so like commercial processed foods, manufactured foods. That's where you'll find the big quantities of trans fatty acids. So things like the baked products, if you look into the cakes, the cookies, the pies, so in that category. But also margarine is very rich in trans fatty acids.
So many Ugandans who eat donuts, who eat fried, foods, who eat some bread, who eat some cakes, who eat some all these confectionaries, find themselves eating huge quantities of industrially produced trans fat, and this is causing cardiovascular issues, including diseases, including early death.
According to a 2018 report by World Health Organization, countries that are slow in the regulation of such foods may see the burden arising from the consumption of trans fatty acids increase over time. In Uganda, non-communicable diseases prevent an increasingly significant burden of ill health and death, accounting for 33% of all death countrywide. The number of Ugandans living with non-communicable diseases has drastically increased, and the probability of someone aged between 30 and 70 years dying of non-communicable diseases is 21%. We engaged some experts on the cases of illness related to the consumption of trans fat foods in Uganda.
The Cancer Institute in Uganda is telling us that 33% of the death that is happening in Uganda is because of non-communicable diseases. And these deaths are not happening because people have reached the time to die. According to World Health Organization, they are dying prematurely, dying before the age of 70, sometimes before the age of 60. Uganda has an obligation under the UN, not only under the UN, also under the Constitution, under the treaty establishing the East African Community, under the laws of Uganda. Uganda has a legal obligation and a constitutional obligation to protect Ugandans from anything like trans fats because they are going to kill them.
Very much, it has been shown actually from surveys and all these other sources of information that increased consumption of trans fats in our diets can actually, it puts us at an increased risk of coronary heart diseases. So in other words, when we take in so much of the trans fats, they increase our risk of having the bad fat in the blood. Some people call it the cholesterol levels. The cholesterol levels or the unhealthy fat in our blood increases, and that puts us at a high risk of having coronary heart diseases and the other non-communicable diseases. So actually in country we have seen that the double burden of these non-communicable diseases or the lifestyle diseases, of which unhealthy diets are a big contributor or contributing factor, have more than doubled in the last 2 decades. Okay?
The government has given assurance to achieve a number of global commitments, including achieving the Sustainable Development Goals, and in this case goal number 2, which focuses on ending hunger, achieving food security and improved nutrition. At the regional level, the African Union Agenda 2063 prioritizes health and well-nourished citizens, with the strategy of reducing maternal and child malnutrition. Similarly, the Malabo Declaration on Nutrition includes a commitment to increase investment in nutrition to end all forms of malnutrition. Despite the World Health Organization clarion call for all member countries to implement the regulations on the manufacture, sale and consumption of trans fatty acids by 2023 to prevent the problem from becoming worse, Uganda seems to have done little or no steps in that direction.
It's an ongoing initiative at the international level. That's at Codex level, where the proposal of elimination or reduction of trans fatty acids in food to ensure consumer health and safety was started by WHO. There is ongoing work. International guidelines or regulations will be developed, and then with support in all these other three committees. What we have to note that Uganda is actively also participating and following up that work with coordination of UNBS as the Secretariat for Developing Standards. And then when all that work is being done, we shall be in position to adopt those international regulations.
However, Rehema Meme, a standards officer and technical secretary at the Uganda National Bureau of Standards, said that there is ongoing research on foods rich in trans fats.
Doing up work, and we are working towards that. At international level, that's at Codex, there is a emerging of an electronic working group that is going to be having different experts who are going to bring on board the different research and also the different knowledge and also the data to support any expertise information that is provided in that electronic working group. That is shared by Canada, and then Uganda is part of it, and also South Africa and very many other countries. European Union is also part of that. So when that time reaches where we have to input the information from Uganda or to represent the country position, we will have now to do all whatever it takes to provide the data.
The East African Community Food and Nutrition Security Strategy of 2018 to 2022 set a clear objective of improving access and utilization of nutrition, diverse and safe food by 2022. This has been recognized in the Ugandan Nutrition Action Plan 2, whose vision is to create a well-nourished, healthy and productive population that effectively participates in the socio-economic transformation of the country. However, the plan does not have a clear strategy for developing regulations that will help eliminate the supply of foods that contain trans fatty acids. This is a violation of human rights as protected under the Constitution of the Republic of Uganda, including the right to food, as many of these unhealthy foods rich in trans fats have no labels, and for those that have, the language is not clear for the layman to understand the content in the foods.
Standards for the fats and oil for which the trans fatty acids could emerge do not have specific limits set therein, and also the labeling aspects of trying to curb the fatty acid is also not clear. But there is ongoing work that is happening that all these standards will be revised, and some of these standards we already adopted them as a country. They are running standards in Uganda, so which means if work is finalized at that level, we shall also have to adopt accordingly and change all the standards to speak the same language. So
approximately 5.4 million deaths are registered globally due to the intake of the industrially produced trans fatty acids. We ask if Uganda has the capacity to treat the illness related to trans fatty acids.
I would say as a country we've done well, and we have facilities in country that can actually manage or help in treatment or management of these non-communicable diseases. For instance, we have, in terms of the heart diseases, we have a fully fledged Uganda Heart Institute at Malabo, and also in the regional referrals you will have these same clinics happening or being facilitated. We have the Uganda Cancer Institute and many others that are really specialized to handle these cases. So if you ask me, yes, as a country, we have the capacity to treat and manage of course, I have highlighted the facilities available, but also have the resource, the human resource needed to ensure.
According to Uganda Revenue Authority, the government body charged with tax collection, trillions of shillings are collected from trans fatty acids. Could it be that there is no will to put in place regulations because they could affect the tax base?
According to the statistics that we have as the Uganda Revenue Authority, we have about 9,273 companies and individuals that deal in that type of products. We are talking of about 4.672 trillion for the past 4 years that we have collected as tax from dealers in this kind of products. Of course, I'm not attributing all the 4 trillion to trans fatty acids products because, like I indicated earlier, they also deal in other products. Now, in 2019-2020, we had about 922 billion. In 2020-2021, we had about 991.4 billion. In 2021-2022, we had a tax collection of 1.265 trillion, and then in 2022-23, that is last year, we had 1.493 billion, meaning that the total that we have collected so far for the past 4 years is about 4.6 trillion from dealers, importers, and manufacturers of these products.
But then, what should be done to reduce the consumption and illnesses related to trans fatty acids in Uganda?
As a country, I think what we need to do, or what we are doing, is that we need to increase awareness. Okay, we need to increase awareness so that the population, the masses can know. We empower them with information on how they can ensure that they are doing health diets and minimizing consumption of these the trans fat foods, the bad fats in our diets.
Normally, tax is used to regulate consumption of certain items. It is, of course, used to collect the revenue, but also regulate. So for us as the URA, we wait upon government to tell us this particular tax you collect, this particular product you do not collect from. And if the Ministry of Health is talking about banning of these products, for us, if it comes out, definitely we shall just abide by.
Uganda has a legal obligation and a constitutional obligation to protect Ugandans from anything like trans fats because they are going to kill them. Secondly, the law requires them to not only protect or eliminate, but also respect our right, prevail over these companies that are selling these dangerous chemicals to Ugandans. We have been working with several stakeholders over the issue, and we think that government will come up with a law to ban trans fats in our food system.